Imagine middle-aged or older adults. However, can suffer from it too. Thousands are born with hip dysplasia, but symptoms often don't appear until the teen years. If left untreated, it can lead to chronic pain and arthritis later in life. Wink News health and medical reporter Amy Osher explains how doctors young active patients stay fit for life.
Shay Stone is at the top of her game.
The game is so fast-paced, and that's what I love about it.
Perfecting her shot since 6th grade. And now her dream of playing lacrosse in college is coming true.
This hat we got on my visit when we first went out there.
But Shay was almost sidelined when her hip started hurting.
It was a deep stabbing pain, like in the groin area of my hip. And I could barely put weight on it.
Shay was diagnosed with hip dysplasia, which happens when the hip socket doesn't fully cover the thigh bone.
We have too shallow of a socket, where the hip is not as rock solid stable as it should be.
Shay also suffered from a labral tear, where the cartilage is pulled away from the bone. Hip preservation specialists were able to combine two procedures into one. First, arthroscopic surgery addresses soft tissue damage. This minimally invasive technique allows for repair of the labrum and removal of bone spurs causing impingement.
We go in and we take care of all the stuff from a soft tissue standpoint in the joints.
Then surgeons tackle the hip socket by cutting and repositioning the hip socket to improve its fit with the thigh bone.
80 to 90% of these patients get another surgery.
As for Shay, recovery took 6 months, and now she's back on the field playing. A true force to be reckoned. Amy Osher, Wink News.
Hip dysplasia is more common in females, and firstborns also have a higher risk.